Welcome and thank you for joining this paper presentation. My name is Delfina Inda and I am one of the members of the scientific team of the Health Informatics Departments of the Hospital Italiano de Buenos Aires, located in Argentina. In this opportunity, I will be presenting our work that aims to inquire about difficulties, needs, and interests related to the disease that people with atopic dermatitis and their caregivers have in order to develop a tool that is useful for the follow-up of the disease. The structure of this presentation is based on four sections. First one is introduction. I will explain why and what was the justification of this experience. Second, methods. I will explain how and where we developed this project. Third, results. I will explain what we found along this study. And finally, the discussion. I will focus on the interpretation and results of this experience. Atopic dermatitis is the most common chronic dermatological disease in childhood and one of the most prevalent pediatric illnesses. This disease affects quality of life. People with atopic dermatitis report shame, anxiety, or depression related to their illness. The fast development of mobile technology and the exponential growing use of smartphones are promoting the development of mobile health applications, which can improve patient compliance with chronic disease management. Likewise, virtual communities of patients offer education on the disease and give psychological and social support. These benefits can be enhanced by involving physicians in these communities. The personal health record of Hospital Italiano de Buenos Aires aims to provide patients and their family access to their personal health information and facilitate communication with their health team. In 2019, a virtual community of patients with psoriasis was implemented within the PHR. Along these lines of work, we propose to design, within the personal health record, a virtual mobile community for patients with atopic dermatitis and their caregivers. Methods. Hospital Italiano de Buenos Aires is an academic, non-profit tertiary level organization that covers all health specialties and different levels of the care system. Since 1998, Hospital Italiano has its own health information system. An integrated personal health record has been available since 2007. The research team developed a survey aimed at atopic dermatitis patients and their caregivers, consisting of 5 questions with structured response options and 5 open-ended questions. Also, semi-structured interviews were conducted with specialists in atopic dermatitis, both dermatologists and allergists, with questions previously developed to guide the meetings. These interviews were individual and last approximately 45 minutes. In addition, a descriptive analysis of the socio-demographic variables of the survey of potential users was carried out. The material of the surveys and interviews were analyzed through content analysis, segmenting the textual material according to emerging analytical categories. Results. The invitation to participate was sent to 78 people, and the survey was answered by 47 people in May 2020, of which 86% were women. The age of respondents ranged from 20 to 65 years, with an average of 34. 81% of the participants were interested in atopic dermatitis because they had a person with this disease in their care, while only 19% of the respondents suffered from this disease. On the other hand, 5 physicians were interviewed in June 2020, representing both genders with different ages and years of experience. 2 were allergy specialists and 3 were dermatologists. specialized in eczema and atopic dermatitis. From the inquiries made to patients and caregivers, as well as the interviews with doctors, four categories emerged, which account for the psychosocial component of this disease: family support, quality of life, eczema flare-ups, and adherence to treatment. Family support. When consulting about the main information needs that potential users have, patient caregivers agree that they need information to help them accompany and assist their children during the course of their illness. They need to have reliable information edited by health professionals who are experts on the subject, but they are also interested in learning about the experiences of other parents who have gone through or are going through similar situations. Quality of life. Doctors, patients, and caregivers agree that atopic dermatitis can negatively impact on the quality of life of those who suffer from it, not only because of the discomfort caused by the symptoms, but also because of the social discomfort that skin lesions can generate, both from aesthetic point of view and in terms of interruption of activities of daily life. Along these lines, they need to talk about issues such as sleep disorders, clothing, makeup, jewelry, nutrition, exposure to the sun, among others. Eczema flare-ups. The two groups that participated in the inquiry mentions that eczema flare-ups as a central issue for those with atopic dermatitis. These flare-ups produce nervousness and stress for the patient and for the environment. Injuries generated in these flare-ups are generally not seen by professionals in the office because when patients get to their doctor's appointment, the injuries tend to be already gone or seriously diminished. Doctors need to be able to see these injuries in order to better adjust the indicated treatment and thus reduce this crisis. Likewise, doctors pointed out that there are several validated self-report tools that can help them have accurate data on the patient's evolution between one visit and another. Adherence to treatment. The health professionals who were interviewed emphasize the importance of adherence to treatment, particularly the continuous care of the skin even when the patient does not show any lesions. This is especially important for the prevention of the flare-ups. Adherence is perceived as a challenge by patients and their caregivers. On the one hand, the cost of the products that must be applied on a daily and chronic basis is still very high. On the other hand, it is very difficult to adopt the habit of taking care of the skin in the absence of symptoms, mainly when dealing with children and adolescents. Regarding the discussion, we think that inquiry about the perceptions of patients and their caregivers about atopic dermatitis allowed us to understand the challenges and situations they face on a daily basis. These results help us design a tool that allows patients and their companions to closely monitor their disease while optimizing the communication with their health professionals. Among the main findings of our research, the need for reliable pieces of information stands out. The evidence shows that education improves patient adherence to the treatment of atopic dermatitis. We decided to include in our atopic dermatitis community a section where specialists generate reliable pieces of information elaborated for the therapeutic education of patients and their families. The results also highlighted the need to learn about other patients and families' experiences who have gone through similar situations. Creating forums for patients with chronic diseases has shown positive effects among its users, promoting self-care and regulating the demands for health services. According to these findings, We have designed a forum within the community where patients and their families can exchange experiences about the disease with the moderation of health professionals who control the information and can avoid the spread of incorrect or inadequate data. Providing health professionals the access to information uploaded by patients facilitates the interaction between the patient and the professional and can mitigate the stress generated by the time during medical consultations. Most physicians value the information provided by patients and recommend it to be uploaded into the EPHR. Following the bibliography recommendations and the emerging findings of our research, we will integrate the atopic dermatitis virtual community to the EHR of each patient so that the doctor can easily access to the data uploaded by the patient or his family from the community in the PHR, even at the time of the medical visit. In that manner, patients will be able to photograph their injuries during the flare-ups, and doctors will have the access to them at any time. This will also happen with the self-report validated questionnaires, which will be available for patients to complete from the virtual community and for doctors to see the results in the EHR and eventually adjust the treatment to the patient's needs. In conclusion, we can say that knowing the difficulties, needs, and interests of people with atopic dermatitis and their caregivers allowed us to design a tool that favors the empowerment of patients and their families in the control and monitoring of their disease while providing a useful tool for professionals. Finally, I want to acknowledge the patients and physicians who participated in the study and the health workers from the Department of Dermatology and Department of Health Informatics from the Hospital Italiano de Buenos Aires. I will be available for any questions, comments, or suggestions via email. Thank you so much for your time.